Debbi Smallwood's come in today. Thanks for coming in. She's agreed to come and tell us about her recent diagnosis, which I think was from 2010, you said.
Yes.
How was the breast cancer picked up in your case?
Well, for a start, I noticed some spots of blood in the bed. I thought nosebleed, things like that, but it was too low. Now my husband's on heart tablets and occasionally gets little nicks in his fingers, so my thoughts were arm round me. Didn't really connect what it was, couldn't work out what it was. And at the time, unluckily, I was wearing black bras because every the ones I bought were in packs of 2 and I was getting rid of the black ones because I didn't like them. Anyway, for my 50th birthday, one of my treats was a couple of nights in London. So off we toddled to London. It was a week after my birthday. We tootled down there. Lovely big white bed in the hotel. Woohoo, jumped in. What's that on the bed? There's a spot of blood. And instantly seen it was from my breast, from my nipple. So that sort of ruined the weekend. Off we went back home, straight down the doctor's. Then I was taken straight, obviously sent straight to Glenfield. And I had mammogram both sides. And then I had an ultrasound. They said they couldn't really see anything, but there was dark areas that they thought was calcification or something like that. So they thought a biopsy would be ideal. So I went back for the biopsy. All through this, being Mrs. Positive, thinking cysts, something I can deal with. Anyway, the appointment was to go back for the results. Went into the room, my husband sat behind me and he still said, "What do you think?" And I says, "No, it'll be nothing." Miss Yakui walked in the room and I seen a surgeon. And my husband said my face dropped, and I think from that moment it was panic. She said, "We found cancer in two out of the 3 biopsies, I think it was." So she says the cancer, although it's contained, it could be anywhere within your breast. So it might only be a tiny bit, but the safest way to do it is to take the whole breast away. I had that done in September. I had the mastectomy on the left side, and they also did the biopsy on the lymph glands under my arm. Again, I told them at work, "See you after Christmas, breast off, implant," because I had the implant put straight in, thinking it was, being told it was just contained within ducts in the breast. Anyway, back for the results after that, and again, Miss Yakui, bad news, I'm sorry, the lymph glands had got cancer in them, so we need to take you straight into chemotherapy. Horrible sensation then, thinking this is getting worse and worse. Mrs. Positive, down a bit anyway. Off I trundled into the chemo. Horrible. I had FEC-T, which was 3 of the FEC, which is the red stuff. That's the one that makes you sick. Although I was very sick with the first dose. So sick, in fact, I couldn't even take my anti-sickness tablets because they were making me sick. I had to go down to the GP and get an injection in the end. The second dose, a little bit sick, but better. However, that's when my hair started to fall out. For a start, it's, again, I can deal with this. But it is such an awful sensation when you go, and I said to my husband, "It is coming out. I'm going to go and wash it hard." And I went and put my head in the bath and I went like that, and I had a handful of hair. So we shave it off, so it was shaved off. I did go and get a wig, but I never ever wore it. I felt that because the chemotherapy had obviously started my menopause or whatever, I was having awful hot flushes. Now, you can wear a hat out and take it off, and that makes people go, "Ooh, she's got no hair," but it's bearable. But I think that I would probably frighten people if I had to take my wig off because I was hot. And the hot flushes were that bad, I literally had to take everything off down to a t-shirt, even in the winter. So I just left myself with a bald head, and I lived with that. Anyway, the 3 FECs were finished, and then I went on the Taxotere, I think it's called. That's a doddle to have, but it feels as if you've had literally you've been chucked on the floor and you've been kicked in all your bones. Every joint hurts, your hips, your fingers, your jaw, every little bit that moves hurts. I don't think there's anything they give you for it. I think it's just something you live with. But through this, I've seen different nurses every time, although I always knew that Lucy was Dr. Osmond's main nurse. But the chemo suite ladies were absolutely, and men, were absolutely wonderful. They were rushed off their feet. The place is absolutely heaving. I don't know how they deal with it all. There's so many to treat, and they haven't got time to be sympathetic with you, but at the same time, my thoughts are, it's like my veins really suffered very, very quickly. They can't be, they're sympathetic, sorry, we're hurting you, sorry, but they've got to do it. And I think that, I sort of live with that. I know it's got to be done. I mean, one attempt, I had seven goes before the needle went in, which was horrific. I was covered in plasters, but it's got to go in. You haven't got any choice. You can't have it any other way. So anyway, my chemotherapy finished. And just started to get little bristles back on my head. And then I had to go for the lymph node clearance in April 2011. So we're now into the next year. I had that done and went back to see Dr. Osmond. Now he said that the lymph nodes were, only the very top part was affected. So he would give me 3 weeks of radiotherapy. So that started in May. Again, rush. I had very early ones, so it was quite good. Car park was excellent. Straight in, get the radiotherapy, and back home by 9:30. Quite frightening sitting under that machine, but you feel nothing, and again you feel nothing from it all. That finished, and straight on to Herceptin, which again is given in the chemo suite every 3 weeks for a whole year. Now, as I was starting my Herceptin, I was getting an awful lot of pain from the breast area. It was hard. It was like having my example was a brick in my bra. Mr. Cooey looked at it occasionally, a couple of times, and she said that it had encapsulated, or it was scar tissue. There was a lot of scar tissue around it. So during my Herceptin, I think it was November 2011, the first time I had it, I had a fat transfer where they give you a bit of liposuction on your tummy and inject it round the breast, which apparently fat tissue has got lots of blood vessels, scar tissue hasn't got any or very few. So by putting the two together, it can actually dissolve scar tissue. That didn't work anyway, so back in again in April this year for removal of the implant, and she put me a smaller one in.